Okay, we're back. Continuing on with the lesson. As I've mentioned, long-term care can be provided in two settings. One would be community-based settings, and the other one would be institutional settings. Let's start off with community-based long-term services. So why do we have community-based long-term services? It has four objectives. So the first one is to deliver services in the most economical and most restrictive setting, and then supplement informal care when appropriate that is given by family members. And then next one is to provide family members some rest from caregiver stress. And then last but not least is to delay or even prevent institutionalizations. And community-based long-term services are governed by multiple agencies, such as the Federal Administration on Aging, the state units on aging. So there are some state local entities that govern long-term care services. And there are also regional and area agencies in aging. So there are more than 600 area agencies, and they were brought about by the federal government when the Older Americans Act of 1965 was passed by Congress and became law of the land. So if you noticed, there were a lot of social services laws that were actually enacted in 1965, and that includes Medicaid, Medicare, and also the Older Americans Act, as was just mentioned. Where do funding for these programs come from? So, well, there's Medicare and Medicaid, there's Title III of the Older Americans Act, there is Title 20 of the Social Services Block Grants. So block grants are basically packages of money that are allotted specific to these needs. And then the Section 1915C of the Social Security Act, Home and Community-Based Services Waiver Program. Private savings and individual savings of patients are also sources for this, as well as private donations. The first type of community-based long-term care service that we will discuss is home health care. And in terms of home health care, Medicare is the largest single payer for this. To qualify for this, there are certain specific conditions, and as we know, home health care is provided in the home of the patients by healthcare professionals. And again, to qualify for this, and where Medicare is going to be paying for the services, the patient or the client must be homebound. There should have been a plan of treatment that is approved and periodically reviewed by a physician. So a physician needs to sign off on it. And it also requires intermittent or part-time, from time to time, skilled nursing care and or rehabilitation therapies. But even if this happens, it would be short-term, where they stay in the institution and then they go back to their own homes. Thus, it stays classified as home health care. Next is adult daycare. So adult daycare is a daytime, community-based group program to meet the needs of clients who have functional or cognitive impairment. So it's meant for adults. And most are focused on prevention, health maintenance, and it could sometimes be supplemented by nursing care, some psychosocial therapies, recreation therapies, and some types of rehabilitation programs as well. Adult daycare centers are actually quite ubiquitous. You find them in a lot of neighborhoods. And the good thing about this is that this is designed for people who are living with their families and with members of their families as their caregivers. So what it allows to happen is that the family member who takes care of the patient or the client gets some form of rest, some respite. So usually, the client can be picked up at around 9 a.m. and then they're brought home at 3. So like the first parts of the day, the family member who takes care of the client actually gets a little break from this, from the caregiving duties. Then we have adult foster care, and these are long-term care services in a community-based setting provided by small family-run homes to non-related adults who are unable to care for themselves. So these are basically households that have received licenses to operate as a foster care home, but it's meant for adults with limited independence. The usual participants would be the elderly, the disabled, those with psychiatric diagnoses, also, some veterans perhaps who have no more families, older veterans and things like that. The states have certain criteria, and they really want these places to remain with an environment wherein it's almost like a family home where the client goes home to. The next one is senior centers, and senior centers are basically what's in the community. Usually these are locations that are already based in the community, and it's more like a gathering of a community for older adults to congregate and socialize. And there could be meals, healthcare services, wellness fairs, health fairs, some health education programs maybe done by volunteer programs, nonprofit organizations in the area. So another community-based long-term service, like I said, it's not just clinical care or recreational care or therapeutic care. This also involves nutrition and food. So we have home-delivered and congregate meals that are made possible by elderly nutrition programs for people aged 60 and older, and this includes their spouses. And this is operated under the U.S. Administration on Aging. And the main goal is to improve nutritional intake of older Americans, older adults in the United States. And this could take the form of congregate meals served in senior centers, or also home-delivered meals, like Meals on Wheels, delivered by volunteers. We also have homemaker, also handyman services. And these are programs to help older people with minor home repairs and errands. And most of these are staffed by volunteers. And here's an example of all those tasks that some clients may actually need help with. Next one is case management. So case management is more of a method, actually. We can't think of this as a specific mode of service. It's more of a method. So it's a method of linking, managing, and coordinating services in order to meet the varied and changing healthcare needs of the elderly, clients who are elderly. And what this does is it's done by professional social workers, for instance, and they assess the needs, prepare a care plan to address those needs, identify the appropriate services that clients need, but then they also have to know the ins and outs and navigate the social welfare system. So they have to determine eligibility, they have to arrange financing, ensure services, perhaps arrange transportation, and then Aside from helping the clients directly, social workers also assist the adult children of disabled elderly persons to be able to navigate the system. And last but not the least is what we call the community-based um, continuing care retirement communities. And this is more of a concept of aging in place, and this usually happens more on an organic manner, meaning in a natural way, such as, like, for instance, an entire block, uh, in a span of 20, 30, 40 years, before you know it, everyone who lives there, or there's a majority of the population that lives there, are elderly. Or one building, for instance, just naturally occurs because maybe it was new in the 1960s and young couples bought units there, and then their children have left. This has happened a lot in New York City, and in major cities where there's population density concentrated in specific areas, where you have a lot of real estate development, and young couples basically start out, and then before you know it, several decades later, they're still there, and all the other older couples are still there in that building. And then it's a naturally occurring um, phenomenon. So there are different ways to get this done, but it is meant to address the changing needs as well as the specific needs of clients. So there's a video after this, lecture video. Make sure to watch that because it's a perfect illustration of this concept called continuing care retirement communities, which is based on the principles and philosophies of concept of aging in place.